Today's episode is Tiotropium, brand name Spiriva hand inhaler and Spiriva Respimat. The pharmacologic and therapeutic class is that tiotropium is an anticholinergic agent. Also, it's known as a long-acting muscarinic antagonist or a LAMA. Dosage form and strength. The medication comes as an inhaled aerosol solution in a 1.25 microgram per actuation and 2.5 microgram per actuation strength. It also comes as an inhaled capsule in an 18 microgram strength. It is noted that the inhaled capsule does contain milk proteins. Indications and dosing for adults. The first indication is for chronic obstructive pulmonary disease, or COPD. Regarding the inhaled capsule via the hand inhaler, the treatment is inhaling 2 puffs of 1 capsule by mouth into the lungs every day. There is a max of 1 capsule every 24 hours. Capsules use the hand inhaler device only. Regarding the inhaled aerosol solution, inhale 2 puffs or 2.5 micrograms by mouth into the lungs every day. There is a maximum of 5 micrograms per day. The next indication for adults is asthma. Regarding the inhaled aerosol solution, the maintenance treatment is inhaling 2 puffs by mouth into the lungs every day. There is a maximum of 2 puffs per day, or 2.5 micrograms once daily. Max benefits are seen in up to 4 to 8 weeks or earlier. It is recommended to use 5 micrograms per day in patients with poor response to inhaled corticosteroid or long-acting beta agonists or adults with severe asthma. Indications and dosing in pediatrics. The main indication for pediatrics is asthma. Regarding the inhaled aerosol solution, the maintenance treatment is approved for 6 years of age and older. The dosing regimen is to inhale 2 puffs or 2.5 micrograms by mouth into the lungs every day. The max dose is 2.5 micrograms every day. Mechanism of action and pharmacology. Tiotropium exhibits reversible competitive inhibition of acetylcholine at type 3 muscarinic receptors in bronchial smooth muscle. The inhibition leads to bronchodilation. The medication is poorly absorbed in the GI with systemic absorption from the lungs. It is hepatically metabolized via the CYP2D6 and CYP3A pathways. It is excreted in the urine. The time to peak for the dry powdered inhaler for the DPI and inhaled caps is around 7 minutes. The soft mist inhaler, or the inhaled aerosol, is between 5 to 7 minutes. The half-life elimination for the DPI and soft mist inhaler is around 25 hours in patients with COPD, and the soft mist inhaler for patients with asthma is around 44 hours. Tiotropium is 72% protein bound. Special populations and considerations. Regarding considerations in the renally impaired, there is reduced clearance and increased concentrations in the plasma. Regarding the elderly, there is reduced clearance for the medication. Some contraindications and cautions of note are in patients with acute bronchospasm, hypersensitivity to milk proteins, which are the inhaled caps, creatinine clearance less than 60, in patients with glaucoma and bladder neck obstruction. Regarding pregnancy, although the data is limited, the benefits appear to outweigh any of the risks. Uncontrolled asthma during pregnancy increases the risk of perinatal mortality, preeclampsia, low birth weights, and more. Regarding lactation, there is minimal drug excretion into the milk. Side effects. Some common side effects are cough, xerostomia, headache, GERD, palpitations, dizziness, rash, and UTI. Some serious side effects are paradoxical bronchospasm and angle closure glaucoma. Drug interactions. The main consideration for drug interactions is anticholinergics. Some contraindicated drugs of caution are clozapine, amantadine, amitriptyline, aripiprazole, codeine, diphenhydramine, tramadol, and potassium citrate, chloride, and phosphate. Monitoring parameters. Signs and symptom of anticholinergic if patient has a creatinine clearance less than 60, FEV1, peak flow, and signs and symptoms of narrow angle glaucoma and urinary retention. Patient counseling information. Tiotropium is used to treat patients with COPD and asthma. It is not a quick relief inhaler, and it is not to be used to treat flare-ups or shortness of breath. Do not use more than 2 times or 2.5 micrograms in a 24-hour period. In order to get optimal results, tiotropium should be used at regularly and evenly spaced intervals. Clean the inhaler at least once monthly with water and allow to air dry. Rinse mouth out to prevent dry mouth and throat irritation.